And welcome back. Military Appreciation Month in May was a time to reflect on the dedicated service given by our military members in our communities. However, there is a cause to celebrate and appreciate all year round, so we're kicking off June with a very special guest from the VNS Health Veterans Program. The daily contributions made by our servicemen and women are worth calling out not just on Veterans Day and Memorial Day, but actually they deserve attention 365 days a year. And here now to share more of her perspective on some of the health challenges the veterans in our community are facing is the director of the VNS Health Veterans Program, Contessa Officer. And Contessa, we're glad to have you with us.
Thanks, Darren. I'm happy to be here.
I think I am missing her in my, well, I can't hear her on the floor, producer, but just want to let you know, or I should say Mr. Director. But let me go here, Contessa, and talk. First of all, thank you for the work that you do, particularly when it comes to the lives of veterans. And when we look at veterans, we know that sometimes they do have unique needs. Would you share with us a little bit more about some of the unique things that veterans need by way of their services?
Absolutely. Again, thank you for having me here. So, the program at VNS Health, our focus is on veterans, but not only veterans, but their families. We want to help ensure that they're getting access and support for all of their healthcare needs. And that can encompass both their physical and their mental health. So, with veterans, they've served the nation honorably and they've been selfless in their giving. And in return, we want them to know that they deserve excellent and compassionate care, no matter their age. But especially as they're getting older, those supports are important. So there are certain factors that may impact their health. For example, access to housing, addressing food insecurity, or just being mindful of factors like substance abuse disorders. These plague our veterans as well. So at VNS Health, we want to connect veterans with VA benefits and any resources that are out there in the community that can help them. So, for some of our veterans, especially those who served in Vietnam and World War II, there can be a stigma about utilizing their veteran benefits. There's often a concern that using their benefits might take them away from another veteran who needs them more. Our team at VNS Health is composed of former military and veterans, as well as veteran benefits experts. And we understand the needs of veterans. And all of us have this streak of advocacy. Many veterans who come back, they don't feel like they want or need to access these available benefits. So we're here to tell them that they can and they should access their benefits, especially beforehand, before they get to a point where they're in a crisis. Also, when it comes to medical care and support, a lot of the work that we do involves just listening and talking with the veterans. We want to find out what are their specific needs, and then we want to recognize them also for their service that they've given to our country. So with VNS Health, we focus on supporting veterans and their families across the continuum of care to make sure that they have the best medical care that they can get all the way through their life.
And Contessa, let me jump in and talk to you a little bit about servicing veterans. I know you mentioned before about certain veterans that participated in Vietnam War, what their perspective may be. Do you find that veterans from different eras cater to different things in terms of needs?
That's a great question. Certainly, we find that when it comes to Vietnam veterans, their experience coming back has been very different from other veterans. So, one of the things that we try to look at is their experience. Being veterans, they have similarities, but they also have differences. So, listening, asking questions, trying to find out what are their specific needs. With Vietnam War veterans, oftentimes they just want to be acknowledged for their service. They want to have someone who understands that they have specific challenges and needs. So, what we try to do is make sure that we are attentive to their specific needs and then we address those accordingly.
One would not believe that there is a stigma when it comes to utilizing benefits. I think that sometimes we say, hey, we got the benefits, we'll take full use of them. But in the minds of veterans, sometimes there is a stigma when it comes to utilizing benefits. You spoke a little bit about it earlier. Please break that down a little bit further for our viewers because I think it's important to understand, the mindset sometimes of some of our veterans when we talk about being selfless, how they continue to even be selfless when it comes to this area.
Absolutely. So oftentimes they'll return back from their active duty service and they may have physical and emotional scars. And our team is trained to deal with that. So often with a veteran, they may have service connected benefits that are available to them based on their need. They have unique needs, and these are conditions that arise from military service. For instance, some of our veterans may have cancer, brain injuries, illnesses such as Lou Gehrig's disease, Parkinson's disease, prostate cancer, or even Alzheimer's disease. So for many veterans, also they struggle with isolation, right? It can create extra stress for them and anxiety, as well as for their families. So sometimes what we try to do is we look at what is their specific issue that they're dealing with, and for instance, some veterans struggle with PTSD, others struggle with depression, and some have issues with mental or physical issues. So, based on that, we do an assessment and then we connect them to services. For example, isolation is a real issue with veterans, especially our elders, and it makes it harder for them to attend things that are available to them, like support groups, and for them to get together with other members of the military community, which has been for them their brotherhood, their sisters, brothers and sisters, and veterans. And it's difficult sometimes for them to even be a part of the community that has supported them in the past. And we try to reinforce their sense of self worth by re-establishing those connections. We see quite a bit of isolation that took place also during the pandemic. So VNS Health stayed in touch with veterans during that time as well to make sure that they had someone that was listening to them. Much of what we do at our program is to let veterans and their families know that we have resources that are available to them and to assure them that they're able to get the most out of them, which is not always easy.
Yeah.
We work by, yeah, we work to provide care that honors their sacrifice, not just for the veterans, but also for their families, because their families did serve as well.
I want to talk about you for a moment and talk about your experience because obviously you bring a certain experience set that you bring into your work and connect it to for us. How does your experience really parallel with the work that you're doing?
Absolutely. So, just having experience in the military does give you valuable perspective. It makes it easier for when you are speaking with veterans to understand some of the things that they're going through. You can share your own experience and let them know that you really care, and they can feel the sincerity. My father served in Vietnam, and I saw firsthand how challenging it was for him, and also for my family. When he suffered a stroke and he was in need of hospice, we had to access these VA benefits, and it was not easy trying to figure that out. So I watched my mom and then eventually myself trying to work through this process to get him all the care that he needed. So we want to make sure that our clients at VNS Health are able to navigate this system and not do it alone. So we work with the families to determine what benefits they qualify for. Some of the benefits could be disability claims, access to the VA healthcare system. Again, a lot of veterans don't use that system. There are spousal supports. We have a lot of spouses who realize that there are benefits that they also can qualify for, money that can help them even when their spouse passes on, that can allow them to even be able to stay in their home. We can even help them replace lost medals. Some of our veterans, they've lost the medals that they've earned, so we can help them get those back. And we make connections for them. That's the key, making the connections.
Right.
Most people in the military, they have a lot of pride and they can be very independent. And we want them to know that asking for help and seeking resources is not, it does not make you weak. It actually is something that you're entitled to. And we want to make sure that you take advantage of it.
Yeah.
We're very well connected with the VA. So we know the process and we know who you need to talk to. We know what forms you need to fill out. And we just want to make it realistic for them as well. We want them to know there's a timeline, and just so that they know when they're going through the process, they don't have to go through it alone. And one of the things that we really try to do is do a lot of outreach. We want veterans and their families to know across the five boroughs that they have support through VNS Health and that we really appreciate their service.
Thank you so much, Contessa, for sharing with us the work that goes on in really helping to improve the lives of veterans. Thank you for your service and servicing them and what you do to really stabilize and to make sure they're taken care of. Thank you so much for being with us.
Thank you, Darren, as well.
All righty. Well, I want to let you know if you want more information, go ahead and visit the website at vnshealth.org and then also call them 800-675-0391. Again, that number 800-675-0391. A special shout out to all of our veterans for the work and the service that they've done in helping to keep our country safe. All right, we encourage you, don't go anywhere. We got more open coming up right after this.